My name is Bill. I've been a physical therapist for almost 10 years, and I've been working in the Sports and Orthopedic Physical Therapy Department at Nationwide Children's Hospital since early 2007. I've always had a strong interest in EBP. There was a strong evidence-based practice component to my graduate school curriculum, and it's been a pillar of my clinical practice since. Well, it's part of our mission of the hospital is to provide the highest quality care. I think to achieve the best outcomes, we need to be able to integrate the best available research into our clinical practice. So what I would want others to know about EBP is that it's not as difficult or time-consuming as I think people perceive it to be. In school, it was an academic process, but going through the Immersion course, you realize how practical, easy, and not time-consuming the process is. And I think going through those steps really provides you the opportunity to provide the best care for your patients. A lot of the forms that we use for evidence-based journal clubs are based on what was taught at CTEP. We also utilize their implementation template to make clinical changes at a department level. We started with one of our most commonly seen diagnoses in the Sports and Orthopedic Physical Therapy Department, patellofemoral pain syndrome. We conducted a thorough literature search on the evaluation and treatment approaches, and based on that review, we were able to modify our current evaluation template and create a new algorithm for the treatment of this condition. And based on our results, we were able to see that we were able to decrease the average number of visits and increase the score on our standardized outcome measure that we use. I think the biggest change for me is that I've become much more efficient with the EBP process. Even though I've been doing it since 2004, the things I learned have made me much more efficient. What used to take me up to a couple of hours now takes 10 to 20 minutes. What I liked best about the CTEP Immersion course versus other courses that I've been to in regards to evidence-based practice is its duration and the amount of mentors that they have at the course. Since the course is a week long, you really get an opportunity to practice the skills that you learned, as well as work through a real-life clinical example that you're able to bring back the next week and make a change to your practice.